You're listening to the Yoga Medicine Podcast. I'm your host, Tiffany Cruikshank. Our podcast brings you information and resources to enhance the therapeutic effects of your practice based on a deeper understanding of anatomy, physiology, and the integration of modern science and research with traditional practices and experiences. Join me and my co-hosts, Rachel Land and Katya Barch, as we dive into all things yoga, research, and wellness. Oh, welcome back. Welcome back. We're talking about overhead shoulder pain, and we're going to get right into it. Such a common thing to run into in yoga, people who have that kind of really typical pinching pain when they take their arms up overhead. You can imagine that comes up in a lot of things in yoga, much less just throwing your arms up overhead in Warrior One or Warrior One, crescent lunge, downward facing dog, wheel pose if you're adventurous.
This is one of those topics that for me comes up. I have in my head a small list of the niggles that I tend to see over and over and over again in students. And there's, that hamstring tendon strain, there's pain at the front of the shoulder, and then there's this pain at the top of the shoulder, wrists. But this short list of things that I tend to see over and over again. And this is definitely in that short list of just common challenges that students face and that I've faced myself in my practice.
And such a big one for overhead athletes, for anyone who does a lot of repetitive motions with their shoulder, especially anything overhead, and for really anyone with two arms.
or even
one. Yeah. I mean, with the shoulder joint. So, it's a possibility. And, it's one of those things, if we live long enough, maybe you've experienced it. It's definitely on the top of the list of common issues to deal with in the body. And something that I think is really helpful to look at a yoga scenario too, because it's kind of challenging to move through a yoga practice if you can't bring your arms up overhead, at least without pain, right? I mean, maybe they can do it, but maybe they can't go all the way. Being able to easily move the arms up overhead without pain is such an important part of a practice too. So
yeah, and one of the reasons for general life, for reaching up for things, getting your shirt on or off, or your sweater on or off. Right. Like once there's irritation there, drying your hair, combing your hair. Yeah, just can become this really irritating, repetitive factor in life that's worth, I think, looking at in a bit more detail.
And I think yoga kind of a lot of times uncovers those things. It kind of forces us not to look past them. So, sometimes we might blame our injury on them, and maybe rightfully so, but it also exposes those things. And I think I love that about the practice, that it doesn't let us kind of
get away with anything.
Yeah, it kind of makes us pay attention to things, and
ain't that the truth?
Kind of upkeep. So
physical, mental, emotional, physiological. It's true. It really does reveal you to you.
So, what we're talking about here a lot of times is talked to as or referred to as impingement, which can be kind of a loaded term, but basically what we're talking about is this compression of these structures between the acromion. So if you take your fingers while you're listening to this to your clavicle and just start to walk out laterally toward your shoulder, you'll feel that little bump of your AC joint you might be familiar with. And then you keep going and it flattens out and kind of broadens out. That's the acromion. And so what we're looking at is the glenohumeral joint being underneath that. So if you kind of fall off of that flat bony prominence of the acromion, you feel that head of the humerus. And so what we're really talking about here is that space between the head of the humerus and the acromion, which we know is where part of the rotator cuff has to go through. We know the rotator cuff is going to attach all around that humeral head. We also have a bursa that lives in there. So you can imagine there's only so much space between that acromion, which is part of your scapula, your shoulder blade, and the head of the humerus. And, if that space becomes smaller for whatever reason, maybe the structures within it start to take up more space. Maybe there's some inflammation there or some swelling there, or perhaps there's a bony structure that's a little different, or maybe osteophytes or bone spurs that are kind of have grown into that space, that it can irritate or create pain. It can be a pain generator in the space. So basically what we're talking about with this overhead movement a lot of times is this idea of impingement, which is often a term that's been used for a long time. or this compression. We can think of the structures in this space causing
You might have just
pain.
heard it called subacromial pain or rotator cuff related shoulder pain. There are different titles for it that you might hear now, but it all seems to refer to the same kind of basket of things. If something on the very top of the shoulder joint underneath the acromion is getting irritated.
Well, and I think, in my past, my education and my experience of it, it's always a lot of times been referred to as impingement, and things are starting to change. We're starting to look at how language and identification with these,
Mm,
diagnoses can change our relationship to pain. So I think, classically definitely referred to as impingement, but I think our job as yoga teachers and healthcare providers is starting to unravel that identification and attachment with the diagnosis. And, really all we're looking at here is a subacromial pain syndrome
mm,
potentially. We could call that our pain pattern or whatever you want to call it. But our job is to really look at what's going on there. Is it a primary issue? A lot of times it's categorized as primary versus secondary, primary being based on the bone structure. So again, either what I'm born with or bone spurs or osteophytes usually associated with arthritis, or secondary issues. So really what we're talking about there are biomechanical influences, repetitive motions, irritation, inflammation, nociceptive issues, nervous system sensitization. So there's a lot of different reasons that can
mm.
cause this kind of this really typical classic compressive pinching pain when lifting my arm overhead.
Mm. And I think it tends to come up, or at least in my experience, it at least is triggered by or I notice it first in positions where there's more load on the arms. So when it's been present for a little while, I might just feel it lifting my arms up, as you said, in crescent or warrior one. But usually the first time I feel it is something where I'm pulling with my arm or holding weight with my arm, like in downward facing dog or in handstand prep or wheel pose, as you mentioned, or pulling off a sweater or pulling off a shirt or doing an overhead bind where there's not just my arm being lifted, but some kind of force involved as well. And I guess once it's irritated, all bets are off. I might feel it just lifting my arm
Mhm.
up, or I'm talking back in the past. I haven't had it for many, many years now. But to start with, it was usually when the arm was taking some additional load, pulling, pushing, whatever.
Yeah, and I think one of the issues with the medical terminology of, calling it impingement is we tend to identify with this idea of it being a bony structure. A lot
Mm,
of times this need to go and have surgery and have it shaved off, and sometimes that helps and sometimes it doesn't. In fact,
yeah,
you look at the research and you can see a lot of people have issues in this subacromial space that don't have any symptoms, and people
100%.
have symptoms that don't have issues on imaging either. So
Mm,
we know that there's, if you've listened to much of our stuff or done any of our trainings, you've probably heard us talk about all the different inputs to pain
mm,
and influential factors in pain. And this is no different, of course. However, there's just so many things that can be involved here, even within this space. We've got the subacromial bursa, we've got the supraspinatus tendon, we've got the joint capsule, which has really rich innervation, which can also be compressed. We have the long head of the biceps nearby. We've got even potentially the upper part of subscapularis that can sometimes get compressed here, and even the upper part of the infraspinatus. I saw studying that a long time ago where they were looking at the angling of the fibers actually going of the infraspinatus going under there too. So,
mm,
there's a lot of potential options here of things that can be involved. I worked with uh physical therapist who worked with the pro baseball team a long time ago, and I remember he opened my eye up to this idea too of the lats being an influential tissue of with the lats are tight, and he worked with a lot of overhead athletes, pitchers
mhm.
and whatnot. And that this idea that the lats can actually push the head of the humerus up when it's really tight as being that tissue kind of right underneath it. And um, I've found personally the lats to be a really great area to work with too. So also maybe not just tissues that are in the joint space, but
Mhm.
as we know, everything around it that's influencing it
Yeah.
being
And I think
really
that comes up
important.
in particular for the shoulders because they are such mobile joints, and all of the tissues that surround those mobile joints can influence their position slightly. And sometimes it only takes slight changes to change your experience of a joint. So even if it is, a millimeter of change in position from this sort of chronic tension in the lats, then that might be enough to trigger a new experience of you with your shoulder. And I guess the reason why people are being more careful now about using the term impingement is because it can give people the visualization or the concept that something's being kind of worn away. Like each time they experience their pain, it's the bones sawing away at the soft tissues there, and so it can inhibit people from moving or make them fearful of pain, and that can be really unhelpful in terms of getting them to move enough to heal and to create a happier scenario for their shoulder.
Yeah. I mean, I think language is such an interesting thing. Sometimes it's just
Mm,
helpful to be simple to talk about it in, clinical reference with other healthcare providers. But when you're talking to a patient, it can also be really loaded, right? And
mhm,
create a whole nother stigma and story and, inhibitor to movement, which
mm,
is not helpful. So I think how we talk about things is really important. And it's one of the reasons why I think yoga is really helpful because I mean, a lot of what we do, at least with our yoga medicine teachers, is kind of steering people away from the diagnosis, not telling them that it's bad or wrong or not helpful, but really attaching them more to the experience in their body, attaching them to an
mm,
experience maybe that feels more safe or less painful or
mm,
empowers them to move again
mm,
in a different, maybe slightly different way at first, but then, working more and more towards that, like with Lorimer Mosley and all his work on pain, this idea of danger in motion and safety in motion, creating movements that actually feel safe again, and then slowly expanding those until you've snuck them back into those movements they couldn't do once before
mhm,
over long periods of time, usually, maybe, or shorter, depending. Um, but it's like, is it actually a mechanical issue is one question,
mm,
like, is there a mechanical issue? Is it a nociceptive issue? Is it a nervous system issue? Is it a contractile tissue issue?
mm,
Right? Is it bone versus contractile tissue or bursa versus bone? Is there a compressive problem or is there a sensitivity issue? Looking at all the different versus also, even with tendon issues, because we know a lot of times there can be a tendon issue here. The tendon can be inflamed and take up more space, but
mhm,
there can also be degenerative issues in the tendon. This idea of tendonitis versus tendinosis, which is more degenerative, a lack of healing in the tendon. So is it a degenerative issue? Is it an inflammatory issue? Is it even a metabolic issue? There's metabolic factors that influence our capacity for healing. And so
yeah,
there's
and
a
I mean,
lot.
that's exactly why we're having this conversation, isn't it? Because if it were super simple, we would have been done by now. But bodies are usually a little bit more complicated than that, and especially if it's something that's, like I said to start with, this sort of repeated niggle, this thing that comes up either in your training or in your yoga practice repeatedly, then there might be a number of things going on. It started with something fairly simple and mechanical, whether that was bony changes or contractile tissue changes, and then you became wary of it or sensitized to it, or the tissues became irritated to begin with, and so it was more likely that you'd perceive sensations there as pain again, and so on and so forth. So it can be really difficult to unweave those strands and get a simple picture that you can fix quickly.
Well, and I guess it's just a great reminder too, with one diagnosis like impingement, it's not as easy as just saying you do this one thing. And maybe as a teacher or healthcare provider, perhaps you work with impingement a lot and have found certain things to be commonly helpful. Like I'm sure both Rachel and myself have found as well. However, there's still a lot of individuality to it.
Mhm,
And just like really anything, it's one of the reasons why I feel so strongly about training our teachers to do an evaluation, to be able to look at, in the yoga medicine, in the evaluation we do for the shoulder, you get a look at both passive and active range of motion, some of the tests for stability and impingement,
Mhm.
and which again just tells us one thing. Any one of those is just one piece of information. It's like if I gave you one piece of a puzzle, you wouldn't know what the puzzle was without the box.
Cheating.
So I still have to ask and watch and
Mm.
understand and, go through the same things I'd go through with any pain pattern. Like, what are their beliefs around it?
Yeah.
What have they been told, and how
Mhm.
do they feel about that? And,
Mm.
you know, things
What have
like
they
that
done
as
before
well.
that helped? What have they done before that didn't
Yeah.
help? Unraveling all of those stories. And I think I know
Right?
I've said this before. I feel like I say this pretty much every podcast, but having all of those tools in our toolkit as a yoga teacher, I think is even more helpful given that we're not there to diagnose what the problem is. We're not there to confirm
Yes.
or disprove their previous diagnosis. We're agnostic because it's outside of our scope. We're just helping them figure out what's going on right now, what stands out between the side that's giving you pain and the side that doesn't. Let's try some things to see if it helps it feel better and go from there. And that, to me, even though we've got really specific tools to assess range of motion and capacity to engage tissues and which positions trigger pain, there's still this real spaciousness around what we do about it. Let's just see what comes up,
Mm.
start working
'Cause
with
it
what comes up, and we'll see what happens.
'Cause even if someone has issues in a very specific a certain part of their range of motion, where in that range of motion, what's triggering it? Does
Mm,
it make it worse or better to be active? And then are there ways to shift alignment too? And,
yeah.
even sometimes how that humeral head rotates in the socket can move things out of the way
Hmm.
when I'm moving my joint through these ranges of motion. So, obviously there's also little things. Is it just an alignment issue? Can I
Mm,
shift things? Now,
yeah. And
even
sometimes
though
it
we
is that
know,
easy.
yeah, sometimes
So not that often, but
it's
sometimes.
nice. It's nice.
Yeah.
Yeah, so lots of contributors,
Mm,
that we talked about, and, pain is complex, so we'll leave
mm.
also space for there being a lot around our beliefs and our language and our ability to educate them, which we talked about in previous podcasts. I
Ad
feel like we've
nauseum.
done a few, yes.
Yeah.
But then also it can be inflammatory, it can be a nervous system issue, it can be degenerative, metabolic,
Mm.
all the different things. So,
And
or it
just
can
to
be
say
mechanical.
again that the first time it comes up is usually a much clearer picture than this is a thing that kind of flares up every now and again, and I get it every few weeks, and it sticks around for, and then the longer it's been, raising its head, for me anyway, the muddier the picture tends to become, and the more of those factors tend to be involved. Versus the first time, usually it's a little bit more clean cut. I did this thing with my arm and it hurt.
Yeah.
Versus it comes and it goes, and yeah.
First time or just earlier on,
Yes,
versus,
exactly.
years later. Yeah.
Mhm.
So again, I think it's really helpful to know that there are a lot of different contributors. We
Mm,
don't necessarily need to be able to diagnose or be able to point a finger to exactly what it is. If you've done the evaluation we do in our shoulder training and you've, pinpointed some things down, maybe you have an idea. I always, even when I'm meeting with someone for the first or second or third time, I'm still very open to
mm,
the unknown, the mystery still, because until you've
for
worked with someone,
sure.
you really don't understand
And
their
even
body,
then,
their
honestly, I
tissues.
have students
Yeah.
I've been working with for a decade, and there are still things that come up that surprise us both. So it's, people are
And then you
surprising.
start talking to them after class and they were like doing something, that was an obvious instigating factor,
10
which is
hours of
fine.
yard
And
work.
and you have to remember too, I think our job is not necessarily to train for optimal function. I mean, we're looking at range of motion and going through these evaluations, but
Mm,
really what we're trying to do is teach resiliency, prepare the
yeah,
body to be ready for anything,
yeah.
especially the shoulder joint, because it does all the movement. It goes everywhere. And
Mm,
not only should it be able to go everywhere, it should also be able to stabilize us through all of those areas that we can go into, so that it's prepared and ready. So, it's
yeah, I
really
do
about
think it's
training for
worth
the
kind of
resilience.
pulling out that point because something that comes up in discussions online, you know how I love to lurk in the comment field online and read the
Really?
things that, well, no, sometimes I do though. And one of the things that comes up is people like, you're not meant to be weight bearing on your hands. Like they're not meant to be able to carry your
Oh,
weight. And I think it's really worth teasing that out to say we can't assume that people are able to carry their weight on their hands, but you can certainly train your shoulders for that. There's no doubt
yeah.
about it. We see it in yoga practitioners, in gymnasts, and people in calisthenics, and all kinds of sports. You can train your arms and shoulders to do a huge amount of stabilizing and weightlifting. It's just, you just can't assume it on day one of a yoga practice that you'll be able to hold a handstand. But that doesn't mean they're not meant to carry your weight.
Exactly, and I
Mm,
think, also, like, are they made to carry our weight all day?
yeah.
Like,
Hopefully not. Hopefully
and
it doesn't come to that.
how long should they be able to do that? Well, it just depends on how long you need it for.
Mhm.
If you're a gymnast or you're someone that spends a lot of time in your hands for some reason,
Mhm.
maybe you need more of that.
Yeah.
Um, and obviously, again, in overhead athletes, there's a durability to the tissues in response to that. People who've taken any of my myofascial trainings know that response of the fibroblasts to lay down more collagen in response to loading. And so, the same thing with this weight bearing conversation. Our arms absolutely are designed to be able to do that, but if we don't do it, it's not going to be very good at it. So it
Mm.
comes to when we come back to yoga, it's this question of like, when you're doing your first yoga practice, should you be jumping into the all levels 50 chaturangas and 5 handstands and 5 minutes in downward facing dog, and which I don't think is inherently bad. I think our bodies should, if we train for that, can and definitely be prepared to do that. It's not a bad thing. It's not the practice's fault, but it is that we need to slowly introduce progressive loading over time to allow the tissues, which we know collagen and our connective tissue responds slower. So it takes a little bit more patience than
Yeah.
training muscular tissue.
It's like learning any new skill, isn't it? You wouldn't go to a music class for the first time and expect to be able to play, the full most advanced concerto. You would expect to have to
Mozart.
spend a little bit of time exactly doing some scales and learning what the notes are called and figuring out what your hands are doing. And you can do anything. It just takes you a little while to build your skill set and your familiarity, really, is what it comes down to.
Yeah. So, with that in mind, let's talk a little bit about mechanics and then approaches.
Mm,
And let's talk about one thing that I think you and I both really think is important to look at. It might be a little tricky on a podcast, but I think we can kind of get there. If you're familiar with the shoulder blade and that kind of triangular structure of the shoulder blade on the back, at the top of that kind of triangle there, we've got the spine of the scapula, so you can take your hand over your opposite shoulder and feel that spine of the scapula or the shoulder blade going across there. Well, these triangular structures, if you can imagine here, have to be able to move with my arm. They're part of what allows me to lift my arm up overhead completely
mm,
and fully.
mm.
So, in order to do that, my scapula actually has to upwardly rotate. So, if you imagine the shoulder blades, I'm gonna give this a shot
If you're
verbally.
watching on YouTube, it's easy. If you're listening, pull over. If you're driving, close your eyes, visualize those shoulder blades.
Well, if you can just imagine the triangle shape of your shoulder blade, roughly, right? The spine of the scapula is at the top and is relatively parallel to the ground. That is going to start to tip upwards. So if you imagine um, the outer part of the shoulder blade is where that head of the humerus sits. There's a little cup for that head of the humerus. I like to kind of picture it as like a little cup that's holding some fluid. So as I upwardly rotate it, it can actually hold that fluid in the cup,
Mm,
if that makes sense. Otherwise, you can think about the inner edge of that line of the spine of the scapula dropping down and the outer edge lifting up
mm.
as we tip upward. But this upward rotation, because the head of the humerus is connecting to that outer part of the shoulder blade, the glenoid fossa, if you look at a chart of this, it's allowing that cup that the head of the humerus is sitting in to rotate upwards so that the arm can go all the way upwards. So
So it's not just
if
about
I
the arm
limit
bone
that,
moving, it's about the arm bone's connection to the shoulder blade also moving to kind of take up
Yeah.
some of the slack and to give you access to a much greater range.
Well, and it's about the shoulder blade moving as well. And this is an easy one to feel on your own. If you can kind of try with your opposite hand to kind of hold down the shoulder blade from the
Mm.
top or the bottom, whatever feels easier for you. Or you can kind of muscularly force it down and hold it down and just see how far you can go, really forcing your shoulder blade down, both engaging it, mostly engaging it. You can use your other hand to kind of help there too. But really, like, don't let your shoulder blade move. And it's hard to get past 90 degrees, give or take.
Mhm.
It's very challenging. So, there is um, obviously a lot of gray area there for how much you're really stabilizing the scapula there, but you can sense, and
Mm.
really roughly that it is going to be hard to get your arm all the way overhead without moving your shoulder blade because the two are working together, which is what makes this a more mobile joint
And you might have
because
heard
we
that
have the
called
two.
glenohumeral rhythm, which I just love that as a phrase. It makes me imagine that the humerus and the glenoid fossa on the shoulder blade are creating this kind of symphony or music together. Might be slightly
Right.
poetic, but I like it.
I love that. And so then any structures that are limiting that upward rotation too can also cause some issues here because if that scapula isn't able to upwardly rotate, it's going to influence the whole thing. So
Mm.
some structures that can influence that: levator,
Levator scap, my favorite, my
scapula is a big
nemesis.
one. I think both of our one of our favorites. And the traps actually assist it.
Mhm.
So, when we kind of pack down the shoulder blade and inhibit the traps and maybe stiffen that levator a bit, however you want to think about. If I block out that system, it's not going to work properly. So,
And I think
the
you've
upper
really hit on a point there, which is one of the reasons why this can be such a challenging issue to deal with, is because the pain itself is kind of distracting. And the pain is right at the top of the shoulder under the acromion. And that's where our attention tends to go. But just because that's the symptom, that's the squeaky wheel that's causing, calling for your attention, doesn't mean that it's necessarily the root cause. And so it's tempting when you're in pain to be like, it's there, it's right there. That's where the problem is. That's where we've got to work. That's what we've got to deal with. But especially with these beautifully mobile joints and the symphony of movements that is required for them to do their work, you really have to kind of broaden your focus and look a little bit further away a lot of the time, don't you?
Mhm.
Mm.
And so, if I'm not able to do that upper rotation, it's going to be challenging. So, if I'm looking indirectly, a big one to look at is the shoulder blades. So, upper traps and lower traps are facilitating that upward rotation.
Hmm.
And a tight levator is going to inhibit it. It's
Could be
going to
inhibiting
kind of
it.
block it down because that inner angle of the shoulder blade has to drop. So,
Yes.
serratus anterior is
Yeah,
part
that's
of
where I was going to head next. That's a really common problem area under the armpit, just one of those tissues that is, for a lot of us, unfamiliar, hard to tap into. How do you engage that thing? How do you use that thing?
yeah.
I'm asking you, how do I use this thing differently? I've been trying for years.
I'm pretty sure you have some classes on yoga medicine online.
Yeah, I have some serratus anterior. I definitely don't have robust serrati anterior, but they're definitely working better than they were back in the day that I used to experience pretty regular shoulder impingement.
But I'm basically just trying to get this whole system to work better,
Mm.
work together like a nice healthy family, communicating and supporting and adapting in response to different loading and patterns. So, a lot of work around levator, traps maybe. And I think a lot of the work around traps in my opinion in a yoga context is really around just allowing them not to have to pack their shoulders down all the time.
Yeah.
Is like giving them space to be them. The upper traps are always going to be bigger than the lower traps. Like,
Mhm.
do we need to keep coming back to the upper traps? Not that
Relax
there's
those upper
not some
traps,
important work to be
relax
done.
those upper traps, strengthen those lower traps, and that can be really helpful to find ways to encourage the upper traps only to do their job and not also everybody else's, and to have the lower traps kick in and share some of the load. But you're right, I think we tend to demonize the upper traps and give them a hard time for just being strong. It's their job to hold the shoulder complex up against gravity hours of every day. We want
Yes.
them to be big, juicy muscles. That's okay. Don't
Right.
hate them for being how they are.
Yeah. Yeah.
Yeah, and you mentioned there people packing their shoulders down into their sockets. This is something that I still see all the time in people who have, at one point or another, either noticed in themselves or been told that they're hiking their shoulders up around their ears. And for one reason or another, have gotten this message that their shoulders always have to be back and down, always have to be anchored to their back ribs. And, you know, when you're standing in Tadasana, there's some truth to that. It's nice to have your shoulder blades relaxed and resting on your rib cage. But as soon as you start moving your arms, you can no longer fix your shoulder blades in place. They need to be able to glide up and down and around the rib cage. That's their job. That's why they are floating joints, so that they can do all the movements that they need to do. So fixing your shoulder blades back and down as soon as you move your arms is probably not going to be a helpful habit.
Yeah, and I like to think of, the traps know what they need to do. If something else isn't working properly, they might be compensating for something. But I also think it's someplace um that I think of, and I'm just going to use this term very generally, but we tend to store nervous system tension.
No, we
It's not
only
a
store things in
scientific
our hips,
term,
Tiffany. We don't store it
but
anywhere else, only in our hips.
it's like that accumulation of the day. And so I do
Mm,
think there's a place for it. Like, we're not necessarily throwing this cue out totally, but I think, like anything, it can be overly exaggerated, and the body is brilliant. So it doesn't need to be like overly
mhm.
reinforced unless there's a therapeutic reason. But, the traps kind of know what to do. However, you step on your mat and sometimes you're like, oh, yeah, there's my day. I can let that go.
And I think we talked about this in the episode on more controversial yoga cues, that both of us
Oh, yeah.
tend to like cues that are just a little bit softer, like, relax your shoulder blades, soften the sides of the neck, set
Well,
aside
and
the weight of the day, all of those sort of really gentle hints of they don't have to be overdoing it. They know what they need to do.
Well, and it just kind of reminds us too that there's a reason why those are also helpful, is because sometimes when I overly reinforce that cue, I can inhibit the capacity of the shoulder blade to move,
Mm,
which can sometimes cause a little bit of pinching in the shoulder blade. So sometimes it can be, again, an easy alignment thing of like, okay, allow your shoulders to do what they do best, because that upward rotation is going to potentially change things that might
mhm,
look a little bit like the shoulders are hiking. And sometimes allowing them to lift up a little bit can allow and encourage that upward rotation that
mhm.
feels very different to me than someone who's gripping and tensing,
Yeah.
and really forcing. And so I think for me, as someone watching bodies, it's more of a finesse and kind of looking at the overall quality of the pose too, rather than just exact positioning.
Yeah. And I think we're already starting to head toward the differences between how we manage this in a group class population versus what we do with somebody one on one. And in the group class, we're kind of reading bodies and reading faces and observing people's breathing, and just dropping hints usually has to be enough. Or maybe somebody comes up with a question after class, my shoulder really hurts in downward facing dog or in wheel pose. Is there something I'm doing wrong, or what can I do? But most of the time in a group class, it really is just about planting seeds and, over time, building your students' repertoire of tools. So, you might do a class that focuses on scapular mobility, and it's all about letting the shoulder blades move and encouraging glide between the shoulder blades and the rib cage. You might do classes on rotator cuff engagement and have them get in touch with those, wonderful small muscles that coordinate the position of the head of the humerus. I mean, you could do a whole class on the traps and find opportunities to soften the upper traps, find opportunities to engage the lower traps and see what comes up for people. You can offer little tidbits of myofascial release, like levator scap is one that people love slash hate to do in classes because it's usually pretty tender. But there's going to be quite a different approach when you're working with somebody one on one, because then you can really start to dive into what's going on, what positions trigger the pain, what seems to be different between the shoulder that's painful and the shoulder that isn't, and what can we do to see if addressing those differences starts to change your experience of lifting your arm.
But I think, in a group class, it's more preparing, it's more, trying to prepare the tissues to be resilient in whatever frame that is.
Mm.
It versus like where we can't be therapeutic and specific. To me, therapeutic means that it's really more individualized, more
Hmm.
specific to what's going on. Though I think, you can be generally therapeutic in a group class, but you can't be specific in a group class. And
Yeah.
so, if there is impingement, if there is, let's just say, shoulder pain of any sort, I, really want to, I mean, optimally work with someone one on one, even if that's
Mm.
just catching your teacher after class. You might have a teacher who has some awareness and knowledge that could be helpful and could give you some things to look at on your own.
And maybe it
You
is
know,
that super simple, the mechanics of upward rotation as you lift your arm. Maybe there is a little tidbit they could give you that would make a difference. Can't hurt to ask.
but it's one of the things I love about yoga medicine online is, it's more not necessary. It's a little harder to go and find the specific thing if you have a problem. Then you need our find a teacher page. You probably
Yeah.
need to go get a one-on-one teacher, even if that's just for a few sessions, to give you some feedback and some
Yeah.
support. But on the group site, you really can get a look at all of these things in different ways
Mhm.
to find those areas that you can work on to make the tissues more resilient. Is it preventative? I mean, definitely not for traumatic injuries,
Yeah.
probably completely, though I think it does help with the rebound response and the resilience
Mm.
of the tissues to respond to injuries, traumatic or not. I think it's really great to find out those blind spots, though,
Yeah.
to help prepare the tissues to be ready for whatever it is you love. Whether that's
Yeah.
maybe just being comfortable in your body.
Yeah, I totally agree. And I think for me, teaching a therapeutic group class just means I'm trying to offer practices not for their own sake, but because I think they'll be helpful to these as human beings, not just on the yoga mat,
Mm.
but off the yoga mat and in the rest of their life as well. So that to me is what a therapeutic group class is
So to feel better rather than
yeah,
to look better.
yeah, exactly.
In
Exactly.
yoga poses.
Definitely,
Yeah,
because at
I
least
can
for
see
me
that
that
too.
that ship has
Yeah.
sailed. So feeling better is definitely what I'm focusing on. But one-on-one, yeah, it becomes quite a different story, and it really can be fascinating to dive into that with a teacher to pinpoint, like you said, the blind spots. What's
Yeah.
happening? What's not happening? Where are there
And
differences that
something
I can
that's,
work on?
like even in a podcast, especially in a short little, even long hour, short, a little hour. I don't know, is that
We
long for
always think
podcasts?
these are going to
Short
be shorter
anymore?
than they are, don't
But
we?
there's no way that we would be able to tell you this one thing, but there are a lot of common issues like the levator. That's one I really love to do MFR on, and I'm sure that
Hmm.
you can probably Google it on our site and find some stuff for levator
Hmm.
because it inhibits the capacity of the scapula to upwardly rotate and
And
can
let's
create more
pause and
pressure
spell
there.
that because you will always remember, I'm sure, the teacher that thought it was Levator like Darth Vader. So Levator like elevator, Levator, Levator scap. Just to be clear, carry
So,
on. Levator
working
scap,
on
yes.
levator. Another one I love to do MFR on is the lats, like I mentioned
Hmm.
before, because of its potential to push the humeral head up and create less
Yes.
space there. Infraspinatus and supraspinatus that I would
Yeah.
say, supraspinatus is usually the victim. I actually work on that one the least because
Same.
it usually is more of a victim than a cause.
So these are
um,
two of our rotator cuff muscles for those of you who aren't really into the nitty gritty of anatomy. So when I mentioned the rotator cuff as those little muscles that surround the head of the humerus and juggle its position, supraspinatus is the one on top that is often the one crying out in pain. Infraspinatus is one that I often wind up working on, partially because it could be implicated in the pain, as you suggested before, and partially because it's the one that tends to get sleepy in my experience.
yeah. And supraspinatus is the one that really has to go through that subacromial space. So
Hmm.
that's the one, we're often talking about, though, again, it's not the everything.
Hmm.
Also, I like sometimes look at subscap, traps, serratus anterior can also be interesting sometimes, though I would say I look at those a lot less.
Yeah.
And what I love about this, like myofascial work, whether that be with a body worker or whether that be self myofascial work, can be so great at working with pain and also restoring range of motion really quickly.
Mm.
Though, it's not usually a magic fix, it's usually something that has to be repeated over time and done with other things. So, we know that it's not just a matter of, let's just use the term for simplicity, releasing the tissue with myofascial release, but it's also retraining the tissues. And in the
Mm.
healthcare realm, that's often like two different people, a body worker and a physical therapist.
Yeah.
And some do both. Some people will do some of both, but I love that in the yoga realm we can
We can do
also do
both.
both. And
Mm.
obviously, we're not there to replace their medical care. But what's brilliant about this is we can start with the myofascial work, maybe free up their range of motion and clear out some of the pain,
Mhm.
and then start to put that tissue to work. Because in my experience, don't want to just release the tissue or free up, release pain, free up the tissues and release pain, and then just let it go. I
'Cause
wanna
chances are
reinforce that
yeah.
new language of the
Yes.
tissues with active range of motion, active mobility exercises, weight-bearing exercises in a
Mm.
context that's not painful, of course,
Mm.
and perhaps some passive range of motion too, because all of it can be helpful. And then the only thing we haven't talked about too is also, thoracic mobility, and the
Yeah.
cervical spine can also be really important because all that innervation for the shoulder and arm are coming from the neck.
Yes. Yeah,
So
huge. Yeah, I think if I'm thinking about working with somebody, the general approach I would take is firstly, don't make it any more irritated than it already is. This is a good
yes.
time to take a break from loading your arms overhead. And, if you're an athlete and you need to compete, it's not my place to tell you not to compete. But if you're a yoga student, this might be a time to sit out the downward facing dogs and do something else instead, child's pose if you like that, or all fours. Sometimes you can still comfortably weight bear on your hands when your shoulders are lower down, your arms are lower down. But step one, don't piss things off any more than they are pissed off already. Let the tissues calm down a little bit. I would often then turn to myofascial release, firstly to help clear out some of that static and pain, as you mentioned, provide some instant relief, and also give you an idea of what stands out? Like, wow, that feels so different to the other side. And that created an instant change in the sensation in my shoulder. Well, that
Mm,
suggests that might be an interesting area to work with further. And then, like you said, look at that blend of shoulder stability, both around the head of the humerus, working with the rotator cuff, and around the shoulder blade, too, working with serratus anterior and rhomboids, making sure that the shoulders are moving really happily and freely. And then, as you said, looking that step further back. Thoracic spine, cervical spine, what's the bigger picture if we keep taking steps back? What else is going on that might be helpful to work on? Yeah.
yeah. And I realize we're planting a lot of seeds for a lot of things. And, if you've not done a training with us, or, these things are new, you haven't done a lot of myofascial release, hopefully there's some little nuggets in here. And then adding in some layers just to squeeze as much as we could in an hour. But what I would say is, you know, there are some people too who just have a little bit of this kind of compressive pain with overhead movement, and maybe it's only in a yoga class that they feel it,
Mm,
and it's just a little, and they can perhaps still go through some of the normal functions of a yoga class and make it through. So they are more for someone more functional.
mm.
You could easily go on the yoga medicine online practice site too and look for some things that you can easily do. The key is you don't want to be, like Rachel said, pushing through pain.
Yeah.
Obviously, it's best to work one on one with someone, though, we know that's not always accessible financially or time wise.
Mm.
We do have a lot of teachers who do online, uh, like Rachel,
Yeah.
online sessions too.
Consultations or
So they're,
sessions.
at least the location thing is not an issue anymore so much. But you can look around for some of these things that we've talked about. I know we have classes on all of these and probably a lot of options, but the levator, the lats, the rotator cuff are all things we've talked a lot about.
Mm.
Looking at that rotator cuff, I know I've got a lot of classes on there. or at least a handful, and just finding things that are accessible to you depending on where you are in that functional range.
Mm,
That might be very different classes for one person than the other. But
yeah.
I've got, like scapular stability and rotator cuff class, and a shoulder mobility and strength, and a
Hmm.
rotator cuff, practice, and lats, and all sorts of things to look at. In fact,
Yeah.
I'm just going to make a playlist called what is it? Shoulder mobility. What will I call it? I'll just call it shoulder mobility.
Yeah.
But you'll know from here that it's much more than that. What do you call it?
Well,
Shoulder mobility,
it's a
because it's
tough
not
one, like
specifically
shoulder
for
function, shoulder
impingement.
resilience, because
Ooh,
you want to.
I'm changing it to shoulder resilience.
I love the
I
word
like that.
resilience.
I know,
Yeah.
me too. I feel like I use it all the time. Maybe I wear it
Yeah.
out, but I don't think you can wear it out. But
It's a good one.
and it's not even necessarily just for impingement, but a great
Yeah.
group
Just
of
overall
classes to
function.
look at improving shoulder function and
Yeah.
resilience in general.
Yeah, I think once you have an idea of where you want to head, and that might be a process of starting pretty broad with, is it mobility of the shoulder blade? Is it mobility of my thoracic spine? Is it cervical spine? Is it coming from levator scap? Is it related to the traps? Once you've kind of narrowed that down a little bit, we'll have a bunch of classes for you to choose from. But I think you've really highlighted why it can be so challenging to work with this condition is I think most of us are just much more familiar with our hips and the structures that surround them than we are with our shoulders. Even when you were trying to describe the movement of the shoulder blade, it was a thing that you were like, okay, stay with me, visualize this. And so if you're a teacher and this has kind of raised more questions than it's answered, um, shameless self-service here, but you should do the shoulder training because at least for me, it was the joint that I was least familiar with going into training. It felt to me the most complex and um, the most different structures that we're having to coordinate and work together. So if this idea of kind of widening your focus and taking a step back from the location of the pain sounded interesting but challenging, it's worthwhile diving into that shoulder training and getting that big picture view so that it doesn't become quite so bamboozling in terms of where you start.
Yeah. Yeah, I mean, it's a great one for teachers who want a really detailed overview of how to
Mm,
look at and assess the joint and work with it from a yoga standpoint,
mm,
with all sorts of different approaches to look at both the tissues themselves that are all involved, the nociceptive inputs, inflammation, I mean, even working with degenerative issues here. I mean, even just simple movements can be helpful in
mm,
some ways for
mhm.
that, staying active. And I think it's a hard one too with people when people have impingement or rotator cuff issues. um, they tend to want to shy away from using it, which can kind of perpetuate things a little bit. So
Yeah,
even
it's
just
tough. I
finding
get
simple
it.
things to do that aren't
Yeah.
specific can be
Mhm.
really helpful. And
Just
obviously
maintaining
there's
whatever
always a
movement you
place
can.
for medical intervention. There are some times where, I have seen patients who had really big bone spurs sticking into it. And, it can be a simple surgery and a simple
Mhm.
solution sometimes. So, there's definitely a place for everything: your physical therapist, your body worker, your yoga teacher, your surgeon, and it's just a matter. I think one of the biggest things with yoga is empowering our students and ourselves to keep looking and investigating and find your truth, because
Mm.
everybody is different and the only truth we have is what works. you know
Yeah,
so
I
we
love
can have the
that.
best theory. It's like any research study, there's always people that don't respond,
Mm,
to the best medications and techniques and protocols and surgeries, and the imaging, right? We talked about the
yeah.
imaging too, which is it doesn't tell us everything. So be your own best advocate,
Mhm.
experiment. That's again why I love having all these options on our site. You can experiment on there, you can experiment with healthcare providers, and just remember there's always other options.
So we will link to a bunch of resources for you to dive into further. Tiffany's playlist on yoga medicine online and the shoulder training. We've also done a previous podcast to help you kind of understand the shoulder joints a little bit better called Shoulder IQ. So we'll link to that as well. So yeah, start the journey, get curious, see what helps.
So, a common issue, not always
Hmm.
mechanical.
Mm-mm.
Yoga can be very helpful. Can be. It's not always the solution. It's not the cure all. There can be other reasons like the nervous system, other
Mhm.
nociceptive inputs, biopsychosocial inputs, even just sometimes mindful movement that can be helpful. And
Mm.
then a bunch of smattering of resources to try out in the podcast. So I hope that gave you some things to experiment with, whether you're a teacher or someone newer to yoga, whether you have this issue or you're working with people who have it or teaching more group classes. I hope you've had something to chew on. As always, we love hearing your comments. So I hope it's been helpful, and we will see you next time.
Woohoo.
Thanks for listening to Yoga Medicine. If you like the show, please be sure to subscribe and leave a rating and review on Apple Podcasts or wherever you listen to podcasts. And if you got something out of this episode, please spread the word and share it with a friend. You can find more information, articles, trainings, and classes at yogamedicine.com, or check us out on social media as Yoga Medicine. You can also email us at info@yogamedicine.com. Thank you for being a part of our Yoga Medicine community. We look forward to seeing you again. The content of this podcast is not medical advice and is not meant to replace medical care. Please consult your healthcare provider to determine what is best for your unique healthcare needs.